Welcome to episode 3 of the NHS Armed Forces Health Podcast, a series that aims to help you, the Armed Forces community, access the plethora of NHS services available. In today's episode, we're looking specifically at GPs, at choosing a GP when you leave service, registering for one, and how to be proactive in your medical needs. For this, I'm joined by Dr. Jonathan Leach, NHS England Medical Director for Armed Forces and Veterans Health, Paul Finley, Director of CSR for Epic Risk Management, and Kat Dalby-Welsh, Clinical Director of the Yeovil Primary Care Network. We like to begin each podcast with the same question to each person, and that is, why are you involved in the AFPPV and why are you here today? So I'm going to ask this question first of all to Paul.
So I'm involved with the PPV, and I have been for a number of years now. And I first got involved as I was very passionate about ensuring that veterans were getting the best possible care, and that the NHS was hearing firsthand what was needed from veterans and their families and serving personnel on the ground. And in my previous role to what I'm in now, working for Blesman, the Limbless Veterans, I was very much at the kind of vanguard of hearing predominantly from those suffering from physical injuries, but just kind of understanding the kind of needs of veterans as and when it was happening in the evolving space that we were moving in at the time.
Brilliant, thank you. Jonathan, how about you?
Yeah, well, it's very clear for me. There's a sort of very personal thing to this, as well as my job at the moment. So the very personal thing is that I was in the army 25 years and served around the world, of which of my 25 years in uniform, 17 were overseas. It included operational tours in Northern Ireland, Yugoslavia, and Iraq. I also visited Afghanistan, and I sort of worked around. And then since I left the military as a doctor, I've been heavily involved through NHS England in terms of the design and delivery of NHS services for the military community. It's not just for veterans, it's for the whole military community. And also trying to make sure that the voice and the needs of the military community, wherever they are and whoever they are taken into account in terms of how we deliver very important services to them and their families.
Thank you. There's lots of great points there, and we'll delve into some of those as we go on. And finally, Kat, how about you?
I'm served in the army for 18 years and I have rheumatoid arthritis. So I joined the lived experience group. And from that, it alighted an interest in the veterans that were living in Yeovil and developing support for them, and many of them with unmet needs. So that's why I'm here.
Brilliant, thank you. So, Paul, how different is the medical care system outside of the military?
Alice, I think it's very different. For me personally, I can't ever remember a time before I joined the military. I joined at 16. I can't ever remember accessing my local GP. It's just one of those things I don't remember as a child ever going to the doctors. And then when you're serving, it's one of those things you take for granted, that it's always accessible. If you're serving in the military and you need to go and see your doctor for any reason, you literally go to your line manager, your troop sergeant, troop staff sergeant, whoever it may be. You say you want to go sick, you walk down to the medical centre, you wait in line, and then you're seen by your GP. And the access to care is immediate, even if that's, primary care, secondary care. And then if you look at kind of the circumstance that I found myself in after losing one of my legs in Afghanistan, being at Headley Court, again, the access to prosthetics care and physiotherapy, I was having 4 physio sessions a day. I was able to just walk down or in my wheelchair, wheel down to the prosthetics and literally just say, I need something tweaked. And one of the prosthetists would take it into a room, do his magic, come back, my leg would be fixed. And then you go through the kind of medical discharge process, and all of a sudden you're back in, your home community, and you've got to register with a GP who probably you haven't dealt with before, because why would you? You're serving the military. And all of a sudden, your expectations of what you were receiving at one point to what you're now eligible to receive is very, very different. And, I think for a lot of veterans, those expectations probably aren't managed very well on transition. They come out expecting the same level of care and support and treatment that they received once when they were in service. And the reality is it's just not practical. It's not practical that you can just turn up unannounced at your doctor's and get an appointment immediately, or turn up at your prosthetic centre and walk through the door and hand over your to your prosthetist and he'll just go away and fix it. That just isn't feasible. So it's hugely different. But what for me has seen has not been different is the level of the level of ability. I think the prosthetists I've got now are just as good, if not better, than what I had when I was at Headley Court. My GP now is just as good, if not better, than what I had when I served. So the level of support is different, but the ability in which they try to support, I think, is the same. And the desire to support you exists. Just because you can't get an appointment for 5 weeks doesn't mean that your GP doesn't want to help. It's just, that's the realities of the situation we find ourselves in. So yeah, I do see why people struggle. I think there's a lot to be done there in terms of managing expectation.
And just quickly, who should be managing those expectations?
I think it's a two-way street, Alice. I think that the MOD upon discharge, nobody explained to me, bear in mind I was discharged nearly 10 years ago, so I'm sure the MOD's evolved slightly, but nobody explained to me what to expect upon discharge. So, I came out expecting that if I needed a prosthetics appointment, I could just go and get one. I wasn't told that I might have to wait 6 weeks, which when you go from being able to get one within 10 minutes to waiting 6 weeks, that is a game changer. Nobody explained that I would need to phone up at 8 a.m. to get a doctor's appointment between 8 and half 8 for the same day. So all these little nuances, actually, if somebody had taken the time to explain the realities of the situation, would have probably made my transition much easier. And I left with relatively uncomplex needs. Even though I lost a leg, it was a below knee amputation. So, again, it's the paper cut of amputations. If you listen to most amputees in the military, so my needs were very, very, very small compared to a lot of other men and women who leave the service. So I can imagine if you've got complex PTSD, if you've got complex physical or mental needs, having that explained to you would only smoothen that transition out of the military and into your local GP practice and beyond.
Jonathan, I want to bring you in here. We've heard from Paul sort of from the veteran, the armed forces community side, but how about you as a GP? Registering with a GP is clearly very important, but how do you go about trying to find or choose the right GP for you?
Okay, so a lot of people will speak to friends and family. Some people will choose on the basis of, the closest that's to them. And obviously there are sort of various websites that will give things like information on patient satisfaction surveys. Now, there are some problems with those, but they will give you an indication, if you like. So people will choose that way. The vast majority of practices have an open list, so you can just go along. There are very few where they have a closed list. So the NHS practices are obviously there for family members in the main and for veterans. Veterans would have an entitlement to register with an NHS GP. And I think probably the main thing is register before you need it. That's probably one of the main messages. The number of people I've spoken with who say, I'm not registered because I don't need one. Well, to be honest, you don't know what's round the corner. And it's much better that people register early. And frequently what we do find is that somebody will come in with maybe something relatively minor, or we'll deal with something relatively minor. But actually behind the scenes, they want to talk about something which is more significant. And actually that, sometimes they'll come in sort of, do they like Dr. Leach? Do they, or don't they like Dr. Leach? And they're to a certain extent testing us out. And that's accepted. That's not specific to the military community. That's quite normal. And then perhaps they'll then come back another time to actually then sort of discuss maybe some bigger concerns. So registering early and before you need it is probably important. If possible, we strongly recommend that people register prior to leaving the services, if you know where you're going to live, so that actually you've got all that in hand in the event that you need it. And then the other thing perhaps is that what we've been doing with my friend Robin Simpson, who's another ex-army doctor, we've now got a network in England. We're building this. We've now got just over 1,000 GP surgeries who have a clinical lead, such as myself, who have an interest in the military. It's in partnership with the Royal College of GPs. And whilst there will be some people as they leave the services who will say, oh, I don't want to see a military doctor, never again. Actually, since we did this as our surgery in Bromsgrove here in Worcestershire, we've actually registered quite a lot of military or ex-military personnel. And what they do is that they say that they are ex-military. And it's not just me as the doctor. It's actually the other staff, particularly people like the receptionists and the other doctors and nurses, having a better understanding of the needs of the military and their families to a degree, and also what may be different in terms of looking after them. So a really important initiative in terms of trying to provide better care and a more specific care to the military community from the NHS end.
Okay, thank you. And are those the veteran-friendly practices? If I was an armed forces member, how do I go and find out where these are?
Yeah, the Royal College of GPs is the organisation that's coordinating this on behalf of NHS England, and they're all listed on the Royal College of GPs website. So they're all there, and so my surgery's there, and people register because they would like to have a surgery which has a more detailed knowledge of the needs of the military community and especially veterans.
Okay, brilliant. Thank you very much. What are primary care networks and why, or what is useful for veterans to know about them?
Primary care networks are groups of practices that work together. It's an NHSEI initiative to bring support to practice sustainability and address health inequalities. And I guess where they are starting to work for veterans is around health inequalities. So the 5 practices in Yeovil are working towards being a veteran-friendly primary care network, which will mean that if you move to that Yeovil area, any practice that you join will be part of the veteran-friendly network. If you think of a GP practice, it works independently of other practices. By bringing 5 practices together, you're able to provide population-based care. And if you think of the veteran population of Yeovil, you're then able to address the needs within that cohort as a one. It's really, it feels as a veteran and a nurse, it feels really healthy to be able to provide a service of equity across Yeovil as opposed to through a single practice. So we're really excited about that.
So one of the things that, because we've got in Bromsgrove, we've got 4 big surgeries. Now, the veteran accredited surgery is mine. But by working across the town, and if you like, my colleagues know that we have this interest in our specific surgery, and I do specifically. So whilst, yes, I will see those patients who are registered with us, what it also means, and I get this quite frequently, I get colleagues from other surgeries who say, Jonathan, I've got this veteran and she or he has these problems. Is there anything specific that we could do? So I'm used as a resource for the wider network. And I think that's really important because we as GPs have to know about lots and lots of things. And certainly I refer internally to, colleagues within the surgery, all the time who have a more detailed knowledge about particular issues than I do. And it's the other way around in this. And so not infrequently, colleagues within my surgery will ask if somebody can see me if they've got mental health problems, PTSD. So if you like, that's my clinical area. But similarly, for the neighbouring surgeries, I will get these phone calls saying, Jonathan, I've got this veteran. Is there anything else that we can be doing? So it works much, much more as a network, as the name implies. And what's really important here is making sure that it's the approach which is important. But then if a referral is needed, that actually they're referred to the best place first time, rather than actually sort of going from one to another and playing ping pong. And so that sort of approach is very much embedded.
Okay, so collaboration and communication is absolutely key, is what you've just said there. But you've also mentioned about the approach. So, Paul, I just want to bring you in here from a veteran's perspective. What do they need to get across? What's their approach in the first meeting with the GP, and also what are the stumbling blocks?
I think the first approach has to try and, where possible, be as honest and transparent as one can be. And I know that that's not easy because a lot of veterans, may not trust their GP on that first visit. So to just completely unload and open up to someone who in my opinion, wrongly feels won't understand the military. I get that a lot, saying, civvies don't understand, civvies don't get it. Well, do you know what? They probably don't get what you've been through, but what they do get is your need for support. Because in that sense, you're no different from any other patient. That GP, nurse are there to support you to the best of their ability. It just so happens, that you once served in the military and you may be entitled, or you may be eligible to access other resources that civilian patients won't. But that doesn't detract from the fact that they just want to help you. For me, the most successful, the reason my GP and I got on so well is that first session that we had, that first appointment. We were both just honest. He was absolutely honest that he'd never dealt with a military amputee. And he kind of said, I will be led by you in terms of you tell me what you need, and then I'll see how I can make that happen. And the first thing was moving limb centre, because I'd been allocated a limb centre that was just a satellite that was only open one day a week. And I said, well, actually, I work in central London. I'd rather go to a different limb centre that I could access 5 days a week. And he sorted that transfer out. But I think that's the most important thing is just being transparent. For veterans, don't go in with a negative mindset or a closed mindset. Try and be open to the fact, and the reality is the person in front of you wants to help. Embrace it. And trust will obviously be established over time. But for me, that's the most important thing. A GP sat in front of you will not know what's going on in your physical, mental space. He won't know what's going on in your private life, what's going on at home, if you've got other issues at work, unless you tell them. There's not a magic 8 ball sat there. So just be honest with your consultant, with your GP, with your nurse, with your physio, whoever the clinician that's trying to support you. Just be upfront. The reality is they've probably heard it before or heard something similar, or they know someone that has, as Jonathan previously mentioned. There's networks out there that people can connect into. So don't feel like you're an isolated case. There's always been people before you.
Jonathan, from a GP perspective, what do you need to know from a veteran?
Yeah, I agree absolutely with Paul. So, people being straight with you. I was reflecting on two things. Firstly, trust. A trusting relationship with your doctor is really important. It's the same with your nurse or your pharmacist. So, the commonest reasons for people to be medically discharged from the military are firstly things like musculoskeletal problems, back problems, knee problems, hip problems, then problems with hearing, and then thirdly, mental health. Now, I regularly see other people with musculoskeletal problems. I've recently, for example, seen a 42-year-old gentleman who's a builder who is really struggling because his back problem is such that he's having real difficulty, carrying things on the building site. Actually, the issues for that builder, as a 42-year-old gentleman who has a family to support, are actually the clinical bits are the same as if it was retired Sergeant Smith, who was also having long-term back problems. So, if you like, the clinical bits are the same. And then what we will do is work with, the person to try and understand what the problems are, to look to see whether or not we can help in terms of mobility, physiotherapy, pain relief. And so what I did with this gentleman is no different. I sat down with him, I listened, actually, because that's probably the most important thing. I listened, I examined him, I then got him physiotherapy, we dealt with his sick note, and actually sort of really put him at the center of this. Now, that's exactly the same approach I would do for a 42-year-old, ex-sergeant, or, because actually that's just being a good doctor. Now, where it gets slightly different is if, Sergeant Smith said, well, it was when I was parachuting and I came down on Salisbury Plain. But actually, in some ways, it's not that different to the builder saying, look, I was on top of a ladder and I fell down on my back. In some ways, it's the same. But, so it's actually listening and really taking into account the needs of the patient. And then what can be different is where you may invoke the Armed Forces Covenant in terms of accessing some of the more specialist services, which I know we'll come on to. And there's a thing in medicine, sort of, it's rather tritely, for the doctor, it's shut up, which is listen, know something, so know your stuff, and care. And that's by Professor David Haslam. And actually, as a model, is really right. So, this is from the doctor side. So shut up and let the patient tell their story, because they will. Listen, don't interrupt, know your stuff, if you like, and be competent and care. And I think that's a really good way of emphasizing and summarizing what we're trying to do as healthcare professionals.
And it doesn't matter whether you're a veteran or you're a reservist.
So there may be specific things. So there may be occupational elements. So, if, for example, I saw somebody who was in the reserves and let's use the same example, had, a very difficult back, which was very painful, then clearly, if they were expected to go on exercise that weekend and to be carrying weight and things like this, there may be very specific occupational elements. And so, yes, we do need to consider those. But a lot of it is the knowledge and understanding, particularly in mental health, about what they've been through. So if, for example, I've got quite a number of the veterans I see who've got significant mental health problems as a consequence of, things they were involved with as a child, unfortunately, and made worse by things in service. There's no question of that. And actually, what I'm able to do, and they, one of them said, "Oh yeah, I was in Camp Batty." I said, "Yep, okay, got it. Yeah, I've been there." And you've got that immediate link. Or I remember there was one veteran who he was talking about being in Northern Ireland, and I said, "Yep, okay. I served in Armagh and South Armagh. I remember that time very well." He didn't need to explain it to me. So sometimes having somebody, not all the practices would have this, but having somebody who's got a similar experience, we're on the same page, and they don't need to explain the context of what the work was like and, what the risks that we were taking, because I was taking very similar risks to themselves.
We've got a really clear understanding of how to access your GP and what you need to be saying. Paul, I just want to move the conversation on a bit now. It seems there is a bit of a difference in people actively seeking help. So that could be mental or physical, depending on whether it's a traumatic combat injury or a chronic degenerative or mental health issue that emerges later. Why do you think this is? And what advice would you give people who perhaps feel like they don't deserve help?
Yeah, I mean, this is something, Alice, that I came across quite frequently at Blesma was there always seemed to be two camps. And there seemed to be those who were, medically discharged due to combat injuries, and then those who either suffered their injuries, their illness, whatever condition they had post-discharge or during service, but not as a result of active service. I was always of the opinion it really didn't matter. The fact that you once upon a time put on the uniform and signed that blank check, that you made a commitment to the country, and ultimately you then deserve the support that you can get, regardless of how, when, why you were injured. But that just because that was how I felt didn't mean that was reality. And I used to have many conversations with veterans, and still do, who, especially those predominantly suffering with mental health, but feel that because they've not been physically injured, that actually they should just shut up and go back in their box. And I'm constantly encouraging people to tap into the services that we offer. The reality is, some veterans get quite defensive. They wonder why these services exist for those who haven't been combat injured or combat wounded. They don't necessarily understand that, on a different day, they may not have been blown up and they may have been involved in RTA. So that kind of mutual understanding that anything that's happened to anybody can happen to any one of us at any time. So it's again looking at through a kind of closed mindset and trying to show empathy where someone's in a different situation from you. But the biggest thing is that genuinely the charities out there, the NHS, GP practices, they don't care. That is the genuine reality. You look at somebody like Blesma, they do not care how you lost a limb. That just doesn't come into their psyche. It doesn't come into the support officers' considerations when they're offering support. I think, I'm not going to speak for Jonathan, he can do that himself, but I'm pretty sure it doesn't matter to a GP why you've got mental health issues or why you're suffering from MSK injuries or whatever it may be. The fact is that you need support, and that's why they're in the position they're in to support.
So just go and get help. It doesn't matter.
Just go and get help. I know this sounds quite tough. I think this sounds quite tough love,
it's
but
great.
Just get on with it. The longer you procrastinate in getting support, trust me on this, the things will not get better on their own. If you need detailed support, then you have to go and ask for it, because the likelihood of someone coming and just offering it to you is very, very slim. So yeah, that's the kind of way I look at it, which probably not the most PC, but it's the most effective.
Yeah, I think I absolutely agree with Paul. There's a difference from when you're serving, when essentially, your boss will tell you, your back's not right, you need to go and see the doc. And you're told, actually. The difference as a civilian is that nobody will tell you. And actually, in many cases, and this has been particularly as we've been looking at the design of the mental health services in particular, going earlier is much better, because the problem is that once a lot of the mental health problems get really ingrained, and they're there for a long time, or even a bad back to a certain extent, that what happens is that they get worse. And then actually it makes treatment worse and less effective. And actually that's the same across lots of things in medicine. It's not specific to this. If somebody had a lump in the breast or a lump in the testicle, leaving it would mean that as and when you come to address it, it's a more difficult matter to deal with and treat. So actually there's a truism there, but nobody's going to do it for you. Now, we know that in medicine, a lot of this is actually your other half will say to you, you need to go and see the doc. And we know this, that frequently it's the other half or a family member who is, look, you need to get this sorted. And so listen to family members, because often they know perhaps better than yourself sometimes. And actually, do go along and seek help. And there are lots of different avenues of help, whether or not that's actually now open access counselling, open access physiotherapy in many parts of the country, as well as obviously through practice nurses. We all have very able, very competent practice nurses who often do a wider range of things. And then obviously ourselves as doctors. So there is help there, but it does mean that person has to come forward themselves. Nobody will tell you. Nobody in the same way as your sergeant or your company commander or your squadron commander will tell you.
And it's a different mindset. So go and get that treatment earlier, I think, are the key messages there. And then obviously that's relating back to earlier, where get registered early with your GP, regardless of whether you've got an issue or not to discuss. Kat, can you relate to this personally?
Yes. So when I left, I didn't really seek any medical help because I think it's odd when you leave. I wasn't medically discharged, but I left with a diagnosis. When you leave, I think what I would love everyone to recognise is that actually employers out with us, the army, are much more tolerant and acceptant of your health than that you feel in the army. So in the army, you feel and you need to be fully fit. And as Paul and Jonathan was saying, you get lots of support in the army with that. When you leave, I genuinely had a fear of nobody's going to want to employ me. I'm not going to get a job. I don't want to tell anyone. I'm not going to tell my GP because I want the employer, because I wanted to work in the NHS, I didn't want to go through Ocky Health and have to declare everything and then I wouldn't get a job. And it wasn't like that at all. Once I understood the NHS, which was because I worked in the NHS, they were much more tolerant and acceptant of health conditions, and it hasn't been a problem at all. And so that's really important. That would be my message in this podcast, that actually it's outside of the world is more tolerant of employers. And then when I did seek the medical help that I needed in the services, it was great.
Thank you. Paul, what is the main advice you would give someone about to leave service?
For me, the biggest thing would be that regardless of what you've got going on, physically, mentally, homework, I can almost guarantee there's been another veteran who's been there and who's came through the other end. And, as much as the military is a huge organisation and the veteran population in the UK is quite large, there's so much support out there for veterans to access, for families to access, and for serving personnel to access. Don't be scared to reach out and ask somebody just for a bit of advice. The worst thing anybody can do is just suffer in silence because they think that either nobody cares or nobody wants to help or nobody can help, because I think all of those can be debunked quite quickly. There is a lot of people that want to support veterans and their families. Guaranteed there's people just in their own networks who, if they ask for support, would give it. So, the biggest problems I've seen a lot of my friends and a lot of veterans that I used to look after in my previous job was the ones that just locked themselves away, and that's not easy. It's not easy to always come forward and to show vulnerability, but that's something that really, just being able to show that side is it will just carry in great stead going forward.
Thank you, Paul. So don't suffer in silence. So Kat, over to you now. What is the main advice you'd give someone about taking care of themselves once they've left?
Be proactive with your care. Take your notes straight to your GP. Seek out, understand what you need to do. So smears, mammograms, different tests. Just proactively manage your care and really accept that your staff sergeant's not going to be there telling you, or your officer's not going to be there telling you need to go to the med centre. You're not going to get that slip that says you need to go and get your teeth checked. That was the biggest one for me, remembering to go to the dentist. That is being proactive with your health.
And finally, Jonathan, to you, we have our final episode of the series is solely focused on armed forces families, but I just want to touch upon it now. For the families of service people, things can still be a bit tricky if you're moving around the country. Can the GP help with this?
Yeah, very significantly. And I think I reflect upon some of the people I've spoken with where things have not gone as well as they should have. And frequently it's when their other half has been posted, and particularly when they've needed access to hospital care. And where the GP can be really, really helpful. A bit, as Kat was saying, is actually bringing the notes to the GP and then the GP being the advocate. So if, for example, I'll make this up, but it makes the point that if, for example, there was a family moving from Salisbury Plain to Catterick, and there was a family member who needed access, and it's often to specialist care, the incoming GP in Catterick actually understanding that this was a military family, firstly. Secondly, that there is the Armed Forces Covenant. And thirdly, if, for example, they need access to, let's say, a rheumatologist and some of the specialist medicines which generally are prescribed by hospital consultants rather than us as GPs, that actually them taking the time and the effort to make the point to the hospital that actually, waiting to get to, if you like, to the top of the list it is not really acceptable. Now, there are ways we often get round this. Now, we can often, as GPs, do what we call advice and guidance. So it sometimes means that I would write to the consultant and say, look, here's, patient X, they've just moved from somewhere. They're on this medication. Could you advise? So sometimes we can short circuit it rather than actually needing a face-to-face appointment, because otherwise what happens is that that person goes to the back of the queue. And that's really not acceptable in any way. And it is a clear breach of the Armed Forces Covenant. And actually, the vast majority of GPs are problem solvers. And they will say, actually, that makes good sense. It makes good sense for the NHS. It makes even more sense for the individual. So have the GP actually be your advocate to do that. And if you've done a little bit of research and you say, in my area, for example, the major teaching hospital is the Queen Elizabeth Hospital in Birmingham, where it obviously has a lot of experience of military personnel. I sometimes get people saying, look, could I go there, please? Or could I go to the Oswestry Hospital, which has a military consultant orthopedic surgeon? And so actually bringing some of that information, could I go there, please? And then the GP picking that up and running with it is really important.
Thank you so much, Jonathan. Some really fantastic points there. Be an advocate for yourself, but have a GP be an advocate for you as well. So on that point, we're going to wrap it up. Thank you so much to all the guests today, Paul, Kat and Jonathan. In episode 4, we'll be looking at physical health. For those with ongoing health requirements, those leaving on a medical discharge, and those who need simply to keep on top of their physical health. As usual, we'll be speaking to a mix of experts, service users, and those responsible for influencing change. We hope you will join us. Goodbye.